The German Diabetes Society states that the main cause of death in patients with type 2 diabetes is cancer. Therefore, for example, there is discussion about lowering the age threshold for women with type 2 diabetes to begin screening for breast cancer. According to current forecasts, in the next 10 to 20 years, obesity and type 2 diabetes will replace smoking as the first place among preventable causes of cancer. Experts are studying potential mechanisms that underlie the frequent co-occurrence of diabetes and cancer. Diabetologists attribute this to long-term hyperglycemia and hyperinsulinemia. However, chronic inflammation is also a possible mechanism. Many people with type 2 diabetes are also overweight, which is considered a risk factor for cancer. As for the risk of developing breast cancer, scientists suggest a relationship in the metabolism of insulin and the female sex hormone estrogen. For the development of colon cancer, the sequence, from adenoma to carcinoma, is currently considered unambiguous, that is, the development of cancer, carcinoma, from benign precursors, adenoma, usually occurs within 10 to 15 years. Insulin as a trophic hormone may stimulate the proliferation of already existing benign polyps. Pancreatic cancer is also closely linked to diabetes. Chronic pancreatitis contributes to the development of diabetes mellitus and itself is also a risk for the development of pancreatic carcinoma. According to current data, diabetes mellitus can be expected to increase the risk of developing pancreatic cancer by 1.7 times. Diabetes is an independent risk factor for the development of hepatocellular carcinoma, liver cancer, based on non-alcoholic steatohepatitis. There is also an inverse correlation. If cancer patients suffer from diabetes, then mortality increases by 30 to 50%. There is also an increased risk that chemotherapy or radiation will be less effective. In addition, some drugs used for cancer can cause hyperglycemia and worsen diabetes. Many cancer patients require a high-calorie diet. This is counterproductive for diabetes. Pancreatic cancer can provoke a diabetic metabolic state. Therefore, in older people with sudden onset of diabetes, the presence of pancreatic cancer must be excluded. Patients with the most common type 2 diabetes, also called adult-onset diabetes, are usually cared for by their family doctor. Only if there is a need for insulin therapy or if there are already complications, a diabetes doctor is involved in the treatment. A diabetes specialist cares for patients with all types of diabetes. A diabetes specialist also treats conditions closely related to diabetes, such as fat metabolism disorders, obesity, and high blood pressure. When visiting a diabetologist, blood pressure, blood glucose levels and foot examinations are monitored in order to be able to timely and adequately adjust therapy. Patients receive medication guidance and education on optimizing diet and incorporating exercise into their daily routine. To diagnose other diseases, the patient is referred to appropriate specialists. For our international patients, the optimal program for a general comprehensive examination is checkup, in order to assess their health status and receive recommendations in a short time. To schedule medical appointments, please contact us via email or instant messengers.